I want to just start off with a statement a little bit. So, I'm a native guy. I was born and raised in Independence, Missouri, went to Truman High School, and graduated in 1978. You don't have to publicize that. This is my home. And there is nothing more important right now, living and being a native of this area, than staying home. There is no question that shelter at home works. Let's go to New Rochelle, New York. Population density, 7,500 people per square mile. Around March 3rd or so, they had 108 cases. They started shutting down the city. They went to March 12th, they went to a containment zone because they had their first case on, I believe, March 2nd, and they were at 108 by March the 12th. 2 days ago, they were at 200. If you did doubling every 3 days, which is the mathematical model for the rapid spread of this disease, they should have been over 1,000. The reason they only went from 100 to 200 is because shelter at home works. We can do this. We can bend the curve. We don't want to be New York City. We want to be KC. And our job and our mission is to bend the curve because it works. I drove home last night. It was about 7 o'clock, 7:30. I left the hospital, went by a park. And there's a group of about 10 or 15 people gathered together, mostly young, in the center of the park. And I wanted to get out of the car and go say to them, what are you thinking? You need to stay home. Don't go out in big groups. Don't go out unless it's absolutely necessary. Stay home. We can bend the curve. And we won't know for about 2 weeks. Today here at KU, we have 16 patients that are positive for COVID-19. I believe we have 8 or 9 patients on mechanical ventilation. We've gone in the last few weeks, we've gone from 1 to 3 to 4 to 8, now we're at, and now we're at 16. So the numbers are increasing. We are on the front end of the surge. If we were to compare that to a football game, the other day we used the example that it was the first quarter, we just got the kickoff, we got a first down for sheltering in place, and now we're here. Okay, well, we've had 2 more plays since then. We're very early in the first quarter of this game. In order to be successful and to beat COVID, which we can do, the most important player in this game is you. It's the people who are listening, are reading, and making the decision, do I stay at home? If you choose yes, we will bend that curve. And if you choose no, we will struggle. So the choice is what we do and what we make every day. Dana. Oh, and can you all mute your line, please?
Yeah, and I would like to absolutely second and echo what Dr. Stites was saying. He was talking about the group of people that he saw last night congregated together. I also saw a group, but I would like to thank our EMS and our firefighters and our police, our first responders. It was the police who were out there trying to get those people to disperse and go back to their homes. It's good to be out, but we don't want the mass gatherings because that's how this virus is spread. And we need to protect our first responders, including our police officers, because they're the ones that do protect us. And so if we can stop the spread overall, we can stop the spread to our first responders, and that is the main goal of why we are trying to decrease the social gathering, to stay at home, and to stop the spread of this virus right now.
Chad. Hey, if y'all on the other end, if you don't mind muting your line, because we're hearing a little bit of feedback from that, if you can please mute your line. Obviously, when you ask a question, don't stay on mute, but if you can mute your line. So Chad Cannon, Chair of Emergency Medicine.
Thank you. I'd like to first start off to thank the media and the public in Kansas City for respecting some of these advice. Patients are not coming into the emergency department unnecessarily right now in our city. That is allowing us to take care of the patients that do need to be there. We continue to have patients who have strokes, heart attacks, who have accidents and traumas. We are taking care of those patients right now and every day, as we always do. We want to continue to have the capacity and the people to to continue to take care of those folks. And we need to keep folks who are just concerned but don't have symptoms out of the healthcare environment and to stay home. We want, though, patients who do have serious signs and symptoms and serious complaints and feelings to call their healthcare providers, and we want to be available to take care of them. I'm so grateful to our staff who is there 24/7 and who's on the front lines, including all the nurses, the techs, the environmental service staff, the pharmacists, my physician colleagues and residents. We're all there, I want to make it sure Kansas City, it's clear to Kansas City and our region that we will continue to be there for you. So thank you once again, and I think we are ready for this if the surge does come, and we're hoping if you heed this good advice that the surge will be manageable and we can flatten the curve.
So I think we're open for questions. If somebody has one, again, I would just ask. There's one person out there. I think we're hearing all your words in your conversation. If you can please mute, but we're open for your questions. Okay, I'm not hearing any questions, so that means I get to fill the space with talk. If there are no questions, are there any questions? This is your big chance.
Hi there. I'll ask a question. Jessica McMaster with 41 News. Sorry, I'm trying to also hear over some of that access noise that's coming in. I was talking with Jill a little bit earlier, and we are trying to get a truthful, accurate piece out there because we're fielding a lot of messages from local medical personnel who obviously don't want to go on the record with their employer, things like that, saying that they don't feel that they're being provided with the protective equipment that they need to be able to care for patients. And so we know that this situation is different everywhere. We want to know what that is like for you guys, where you're at. And if there's a concern that, as you mentioned, people are still congregating, these numbers are climbing, that you could, if you do have enough, that you could run out if people don't start heeding that message to stay home.
Yeah, I'll start with that question. And, I had a meeting with teleconference with Representative Davids today, and that question came up as well. I think overall around the country, certainly personal protective equipment or PPE is on short supply. In different areas, it's more so than others. Certainly here, at this point in time, we have adequate PPE, but looking forward 5, 7, 10 days, and we don't know how this will ultimately turn out, there could be a shortage. Right now, we are also have other orders and other people who have offered to step up and provide us. I think our current state is we have adequate PPE, but again, we don't know how this will turn out in the next week or 10 days. And realistically, there possibly could be a shortage. Right now at the health system, we're okay as far as our supplies go.
Yeah, here's the deal. So this is a really important question. We were on a phone call this morning. We had the privilege of being able to talk with one of the hospitals in the epicenter in Wuhan, China. And during that call, we spoke about what would the impact of the right PPE was. So in Wuhan, and in this hospital in particular, it's one of the largest hospitals, the largest teaching hospital in Wuhan, and one of the largest in all China. And again, the director of their pulmonary critical care, their infectious disease director, the head of their hospital. I mean, it was a great call, a great conversation. We learned a lot. But they talked about what happened before and after they implemented effective protective equipment. And what they found is they did have spread to healthcare workers, but after they put in the PPE requirements, they have had, in the last 6 weeks, they have not had a single transmission to a healthcare worker. The requirements they asked and they implemented are the exact same ones that we're using here at KU. Now, I can't speak to everybody, although I'm on a call with chief medical officers, and I think everybody's trying to do the right thing. I really believe that. So I believe people are safe. Now, the other day we talked about the difference between fear and knowledge. Okay, with Wuhan and with our colleagues around the world, we have knowledge of what is the right thing to do. We also have fear. And there are people who will never feel safe because they're scared, and they have a right to be scared because this is a scary virus. But remember, the virus doesn't have legs. It doesn't have wings. It's not going to zoom around the room and come to you. It comes to you, and the way it gets to you is about knowledge. And we know the equipment that we put people in is appropriate for the level of exposure they're having. And it's different depending upon how much exposure you have. But if we do it as they did in China and as they're doing in Italy, we will not have healthcare workers coming down with this virus because they're here working. Now, they can still pick it up and community spread. And what we know at KU is the percentage of time that our healthcare workers are testing positive is no different than it is in the general population. So I think the virus is here and people will get it, but I don't believe they're getting it here in the hospital, and I believe that to be true about other hospitals. The back end of that question is what happens in a surge. And you know, you're going to think, we are the most boring collection of people you've ever heard because we always say the same darn thing. If you bend the curve, we'll be fine. If we're New York City, that's a scary place. And they're out of safety equipment. And they're begging, they're trying to get more in to make sure their people stay safe. We don't want to be that. We want to be KC. We can do that.
Thank you. I'll just add on to that because Jill mentioned to me earlier, you know, none of us are above hysteria. Like you said, it is scary. Everybody can have a certain level of fear. So for maybe some of those medical professionals at home who, you know, work in different departments, maybe they're not on the front lines treating COVID patients, there seems to be a bit of confusion because, like you said, the level of exposure you're having will determine what type of equipment you need. So what are we looking at? People in the ER who would need this type of equipment, your specified unit. What can we do to kind
You
of
bet. Let me.
the confusion?
Yeah. I'm going to ask Danny to talk, and then we're going to turn it over and let Chad tell you that if they feel safe in the emergency room.
Yeah.
And I have one more story I want to tell.
And absolutely, that's a great question. You know, we had one of our nurses on actually yesterday who probably is one of the person that probably treating and seeing more COVID patients than most people in this hospital and most people in the city because she's on the front line actually treating positive patients. And she has said, you know, she is safe. She is able to use the right PPE for the right circumstances. But it's not only using the right PPE, it is putting it on correctly, taking it off correctly, continuing to wash your hands frequently, and also not putting your hands in your face. And again, she probably has more exposure than most of us, but again, feels safe. Her colleagues feel safe. The other providers feel safe because they're able to do those most simple and basic things of the hand washing and not putting the hands in the face, even though they still are wearing some level of PPE. And that is for the people on the floor, whether it's in critical care units or on the typical medical ward, outfitting them with the appropriate PPE, but also the underlying message of the hand hygiene is very important. Now, certainly I think that might be different in the emergency department. I'll let Dr. Cannon answer that.
Chad, does your team feel safe?
We do feel safe. All my physicians, staff, and nurses have adequate eye protection, masks, and gowns when necessary. We have plenty of stock in the emergency department. Any item that we think we're even getting remotely close to being low on, we immediately are able to get from the supply chain, from the health system. We have not had any shortages.
Now, again, if there's a terrible surge, that'll be a challenge. And, you know, we're doing everything we can to make sure we stay safe. And one of those things is we worked with some local companies to produce eye shields, face shields for us. And I think we're getting like 1,000 of them delivered a day, and there are orders for 10,000. And, you know, it's remarkable when you turn to your community how much they're willing to help you. And that's, again, this is my home, but BKC, this is an important part of living and growing up and being in Kansas City is you know people who know people, and then pretty soon those people are all rallied together to help people. And I think our team here does a great job in the media. They don't want to turn us into memes, and so they glued our hands to the desk so we can't ever touch our face.
You know, I have a funny story.
Go. Nobody asked a question.
It's a positive,
Chad's going to tell
it's a
a funny
positive story.
You should tell that.
You know, our staff are allowed to wear our own eyewear protection here.
Yep.
So a lot of us have gone out to the local hardware stores and purchased our own professional style of goggles. And when I went to the local hardware store here in town, they saw the large number I was purchasing for our staff, and they asked me what I was doing with those, and I said, well, we work in the front line of the emergency department, and they actually discounted those to 75% off to support us. That's only what happened in Kansas City.
That's right,
And
BKC.
it was a wonderful gesture.
Yeah, BKC.
Yeah.
Okay. Question.
I want to make sure I'm giving here to you.
I still hear a lot of chatter in the background. Please use your mute. But is there another question for us? Because otherwise we get to just talk on.
Okay, Jessica McMaster again. I don't know if I'm the only one on.
Jessica,
with,
it's the three of us with you. We are appreciating this
But
one-on-one interview. This is great.
I love it, but I don't know where that noise is coming from. They must just be an observer.
I guess I don't know.
So, okay, because initially my story was going to be protective equipment, because, we don't want to see happening to you guys what we see happening in New York. I don't know if you saw that video from the doctor there who said, yeah, okay.
Yeah, we see all that. And we see it from Italy, and we saw it from China before that, and Spain and France. I mean, it's everywhere, right?
Right. Do you have a message to the community so that we don't become that? And I know you say it's boring, but Dr. Strite, you say it in a way that isn't. And when you said yesterday that for every one person who gets this, at least 2 people it gets spread to, I think that really helps put the stay-at-home message into context.
You bet. Well, yeah, then so that message is exactly the same today because the numbers are the same. We work with folks on the university side, people nationally, folks out of Lawrence. I mean, we have a lot of individuals who work on our modeling every day so we can predict where are we relative to the surge. And I can tell you that if we're New York City, that's going to challenge healthcare in Kansas City. There is no two ways about it. It would challenge any part of this country to be like that. But we don't have to be like that. And the difference is how many people you come in contact with. And I come back to my dirty doorknob principle. So when I walk through a door in a public place, I don't know how many people have touched that doorknob, right? But all those people may have had a little bit of that coronavirus on their hands. They hit the door, you got the coronavirus on your hands, you touch your face, that's bad. Now, the thing you could do is make sure you wash your hands a lot and sing to yourself the happy birthday song. So I was thinking about that this morning. I was sitting there, I was washing my hands before I came down, 20 seconds, right? I sing that song to myself twice every time I wash my hands, which means I have aged approximately 1,000 years in the last week. The reason I do that is because I'm here at the hospital. I'm touching doorknobs. And the only way to get out of being sick from that is to say, I don't want to infect anybody else or myself. And the way I do that is to lower the number of people I spread this disease to. So coronavirus, what is that called? The R0 ratio? Is that what it is?
R0 or R0. Yeah.
Pretty good. I remembered it. I'm not even an infectious disease guy. This R0 or R0 ratio is how many people does one person spread the disease to? And I believe the thinking is that the COVID-2 is around 2.2 to 2.8 in that range. Virus infections die off when people stop spreading the virus. Because again, remember, we keep saying the virus does not have legs. It does not have wings. There's no transporter like there is in Star Trek to zoom it over to you. The only way you can get there is through contact. So if you don't have a lot of contact with doorknobs that you don't know and can't keep clean, and you don't have a lot of contact with people, then what happens is the virus stops shedding, and this goes away, and we're back at the K cheering the Royals, and we're going to be out at Arrowhead Stadium when the stealth bombers fly over for opening day or the first game of the year and celebrating a Super Bowl. That's who we want to be. And we can be that as long as we're willing to make the sacrifice right now. Okay, whoever's out there, you have to mute your line because I can only hear you talk.
Dr. Stites, this is Mike Hendricks from the Kansas City Star.
So,
Maybe left it on from yesterday.
okay, so what exactly does she have to?
Somebody out there saying
She-
yesterday, and what exactly do I have to do?
Reboot the iPad if she wants, or she can close the app and relaunch it, and there's just an IP address that we put a sticker on.
And I
the
hear about your
iPad.
iPad and closing the app, and I hear about your IP address. Please mute that line.
Can you hear me?
I can hear you.
Put it on
Hey, this is Mike Hendricks. I'm a reporter at the Kansas City Star.
the iPad that's picking her up.
The Mid-America Regional Council met earlier this week, and during the meeting they said that work has been underway for several months, not just a couple months, but several months to increase coordination to plan for this pandemic. Can you tell me a little bit about what that entails in terms of coordination between hospitals?
Yeah, I think that's probably to be honest, that's a little out of my lane. That's a little bit more. I think you should direct that over to Mark and ask them specifically what they're doing. From my standpoint, I can tell you that there's a phone call between the CEOs of the different hospitals. In addition, there's a CMO phone call that we try to help organize twice a week. And that call, we have another one coming up tomorrow. We had one earlier in the week. And what we're trying to do is share information, best practice, and just keep our temperature knowing about what's going on. There's also an effort to look at critical care planning across the area that a number of teams are trying to help organize. Some of the folks here and others are trying to help decide how do we coordinate the number of ICU beds. I think that Mark is just trying to be kind of I don't know what the right term is, trying to help us put together some of that work. Also, the Missouri Hospital Association, the Kansas Hospital Association are working well together. We're taking our information and we're broadcasting it. We've had 2 broadcasts this week out to the different hospitals in the western Missouri and all of Kansas to just try and do more education and help people in preparation. So I think there are a lot of different avenues. I think Mark's one of them. Mark can better answer the specifics of what they've been doing.
Well, let me drill down and let's get more practical. Should we see a surge, and you do become overloaded? What is the mechanism for transferring patients or directing patients to the hospitals that do have beds versus the ones that are overloaded?
Yeah, so and Chad can help us a little bit with this. There's a whole EMS system. They know what the relative capacity is of different hospitals, and we'd have to depend a lot on EMS to help us with that. And again, and so Chad, if you can maybe kind of talk a little bit about that, because I think that's probably the best way, because most of those folks are going to be coming in by ambulance.
So we have a system in the city where all the EMS services are aware of the capacity of the emergency departments that they would be transporting the patients to. And so if one emergency department is completely full, we can alert them in advance before they start driving to that particular emergency department, and they can be rerouted to another available emergency department. And we also are looking at the same types of things. If all the ICU beds in a certain hospital become full, we can then make sure the EMS is aware of that so they don't bring a patient that is likely to need an ICU bed to a hospital that doesn't have an ICU bed. So that really gives us a lot more capacity by just having that kind of type of communication from EMS to the emergency department and up into the hospital.
Thank you.
Other questions?
Can you tell us, you mentioned you have 16 positive patients. Can you give us the age ranges? And I'm curious how the young people are doing, if there are young people in that group.
Yeah, in general, we have people from their 20s up into their, their senior years, 90s, and older, actually. So it's a wide range of patients. Our experience is, I think, going to reflect that of others, that the people who are older are not going to do as well as the people who are younger, although we have one person who's younger and who's very ill. So.
Do they have underlying health conditions, did you say?
Yeah, everybody, there are underlying health conditions of varying degrees of severity. I want to be careful. So I'm 60 and I have a couple of underlying health conditions. So, it's a level of severity of that condition and how much that condition affects your immune system and your ability to respond to illness. And so what we know nationally and what we'll know locally too is that those people who have heart failure, lung disease, advanced lung disease are at especially high risk. Cancer patients are also at high risk. People who have had immunosuppression, if they've had a transplant like a bone marrow transplant or a lung transplant or a liver transplant, are a little bit more at risk. people with underlying lung disease, COPD, asthma, that's a risk factor, and people who are on drugs to suppress their immune system. Dane, anything else that you'd add to that?
No, that's it. Again, as you're younger or you don't have other health conditions, certainly your propensity, your probability of progressing to the moderate, severe, and critical disease is probably lower. But we have to stress that just because you are younger does not mean you won't get it, does not mean you don't have the chance of having critical care or critical disease. But again, I think as Dr. Stites said, probably our age ranges is probably similar to what otherwise has been reported.
Next question. Okay, I don't hear any other questions. So with that, I don't know, are there any closing thoughts that anybody wants to leave us with? Chad?
I've been asked quite a bit lately of, when should you come to the emergency department?
Yeah, that's a great question, and really important because we don't want people who don't need to be here being here.
So if you have symptoms of shortness of breath, that your activities of daily living that you do, just going to the bathroom or making yourself something to eat, if you're getting short of breath to do that, that is a serious sign or symptom that should prompt you to call your physician and or if you're unable to get a hold of your physician, to come to the emergency department. If you're having chest pain that's not associated with just a cough, that potentially could be a heart attack or a sign that you have a pneumonia from the coronavirus. That should also prompt you to consider the emergency department. If you are so weak or fatigued that if you feel like you're going to pass out when you get up out of bed or out of your chair, that is concerning. If you have altered mental status or confusion or obviously any slurred speech, those would be signs that you would need to consider the emergency department. If you just have a runny nose or cough and you don't have these more severe symptoms, it doesn't mean you could not have coronavirus. It means you need to first isolate yourself, call your physician, and get further advice on what to do, and not just come to the emergency department because you're worried you may have the coronavirus, even though your symptoms are not severe.
Yeah, I think that's great advice. Dana?
Yeah. Again, I think that we are in the very early stages of this. If there's any chance that we can flatten the curve and slow the spread, we need to continue to do that. We need to continue to have the social distancing and the stay at home. And it's difficult for people because this also brings in other problems such as depression and anxiety because our structures and our world has changed. That leads us to hopefully be able to make a new structure of daily living. Continue what you're doing with getting up. If you're not coming into work every day, we actually do have that favorable experience of being able to still come into work. But if you're not, it's important to create a new structure. If you have your kids at home, create a new structure for them. They're still probably doing schoolwork. Try to get outside, try to exercise or walk or what you can do to get outside. Get good nutrition, get adequate sleep, because all those things are all combined to create this new daily structure in our lives. And I think if we can continue to do that, we can continue to stay at home for right now and continue to try and stop the spread and flatten the curve.
So I went by
Can I
another.
ask a question off of that?
You bet.
Go ahead. What about so I know it's frustrating, and you've mentioned it's frustrating that you're saying stay home, stay home, stay home, and people still aren't staying home. What about the people who just don't believe it? They just don't believe that the virus is that bad. They compare it to the flu, and we don't get locked up for the flu. Do you have a message to those people?
I'll start.
Yeah.
I think my first message is that is irresponsible. They're probably not either talking to people who know. They're probably not keeping up with the media, the accurate media reports. It's a very irresponsible thing to do. That has happened before. We've seen these reports and these news stories about people who were throwing parties in light of all this or going to the beach in light of all this. And now those people have either come down with coronavirus or they're apologizing. So this is a very real thing, and I think it just kind of, again, boils down to personal responsibility, and that's kind of an irresponsible stance to take. And hopefully with enough people that they're talking to or seeing the media, seeing the true news, that opinion can change.
I tend to drive by a couple of parks on my way home, and that's my way of seeing how people are acting. And same night, last night, when I drove by one park where people are there, this big group congregated in the middle, I drove by another park with a walking trail, and it kind of goes around it. And I was so impressed that almost everyone, and there are a number of people out walking, but they're all 6 feet apart.
Yeah.
So, you know what? It's a choice. What will life be the day after tomorrow? I don't know. But I know it's going to be different because a pandemic changes all of us. We can do this. If you want to know what your life will be like the day after tomorrow, you have to choose the sacrifices that give you the opportunity to see that. I don't know what's going to happen after a pandemic. It's going to be different. But I want all these people I know in Kansas City to see it. Because I grew up here, this is my home. And I want these people I care about and who I love to be there. And for those who say, it's not real, yeah, I don't know what you're reading, but it's not what I'm reading. And I think I'm reading the stuff that's telling the truth. So it's a choice. And we have it to make. And what I know about Kansas Cityans and about Midwesterners, from people from Missouri and Kansas, is we tend to be pretty socially responsible to each other. And I think we can make the right choice. And we just have to believe it and do it so that we're back at the K and we're back at Arrowhead and we're back doing the things we love to do. We can beat KC and we can beat the coronavirus. It's a choice. Thank you guys for listening in today.